Hey, thanks, Becca. Happy Friday, everybody. Thanks for being here on a beautiful day. I wanted to share a little bit about my story when it comes to pro-vaccine advocacy, because one of the things that we know is that there's a pro-vaccine majority, but one of the big questions is, where are we? So I helped to found an organization called Safe Communities Coalition. We're about a year old. I guess I've been there for about a year. The organization was founded pre-pandemic, and that turned out to be a pretty prescient move. So we are a organization that organizes folks at the grassroots to do pro-vaccine advocacy efforts. I think of us as a final mile organization. So the three of us that run Safe Communities Coalition are parent leaders of pro-vaccine organizations. Some of us had political experience. As Becca said, I had nonprofit experience, which transferred over to this work pretty nicely, though it's been a journey of learning, let me tell you. We are committed to keeping grassroots folks front and center in the fight, because one of the things that I think you've seen is that typically the pro-vaccine fight has been really dominated by public health experts and folks in white coats, but there hasn't been enough of that pro-vaccine parent majority present in our state houses. So our mission is to support pro-vaccine activities, legislation, candidates, and advocates. And Safe Communities Coalition is currently working in 7, soon to be 9 states with Families for Vaccines chapters. And I'll tell you a little bit more about that. My story from POX to politics, or from POX to political action committees. This baby is my son, Thomas, right before he started daycare. So he went into daycare at about 5 months old, and a few weeks later came home with chickenpox. So as you can imagine, I was really mad about that. I was freelancing at the time and was completely out of maternity leave. My husband, same thing. And the outbreak at our daycare caused everybody except us with chickenpox, or the families with chickenpox, to need to be out of daycare for more than 28 days. It cost our daycare about $20,000. There were families that weren't able to return to daycare that had to find other arrangements. So we were genuinely concerned that daycare wouldn't be there when we got back. And many of you know how hard it is to find a good daycare in the first place. Thomas was really sick. He got pneumonitis in his lungs. He was tiny. And when I took him to urgent care on a Saturday to have him diagnosed, his physician was young enough that she'd never seen chickenpox in the field. She learned about it in textbooks, but because vaccines had done such a great job of largely eradicating chickenpox, we actually had to call in an older physician to help diagnose that dew on the rose rash that he got, which is a lot more romantic than it sounds. So I was really frustrated by this, and quickly learned that Maine law allowed parents to opt out for religious and philosophical reasons. We had that loophole that a number of states still have for non-medical exemptions. And it was as easy as signing a piece of paper. And so I went to the press with my story, and then was connected to a number of other parents that were feeling similarly frustrated. And we were able to organize and pass a law that eliminated those non-medical exemptions from Maine law. Anti-vaxxers in Maine are very well organized and funded, and they organized right back and did a signature campaign. And we brought that to a referendum vote in which 73% of Mainers agreed that we should eliminate those non-medical exemptions. So it was a big victory for us. And we started thinking, maybe this is something that other states could use, this pro-vaccine parent voice. So at the time, the state of outbreaks in Maine was a pertussis leader. We had the chickenpox outbreak in my daycare, mumps and measles. I'm sure you guys are tracking what's going on with polio in New York and the measles outbreak in Ohio. And I don't have to tell you how serious the state of this was. And we've all seen the impact of the COVID outbreak on our communities. When I got to Maine State House, I'd never been there before. I was politically active, but had never testified in front of a committee and really didn't have a sense of what was going on. And I knew that organized anti-vaxxers were kind of a scary force, but I had no idea what I was in for. There were hundreds of parents at our state house, and they testified 3 minutes at a time for 13 hours until 2 in the morning. And, we did our best. We brought a lot of doctors, we brought a lot of parents. We actually had to send a lot of parents home because folks are working. And that's actually been one of the big hurdles to getting the pro-vaccine voice to State House, is that a lot of the people who are affected most by outbreaks are working parents that are potentially immunocompromised or that have immunocompromised children and have to be more careful. So we've had to get creative in terms of how we get folks to our state houses. And what I learned about the anti-vaccine movement is that they are nationally organized, they are incredibly well-funded, and they're working at every level. So they have education arms or miseducation arms, and they're working politically. And we see them in state houses donating to candidates in real time, taking meetings and being taken seriously. And until very recently, that was the voice that legislators were telling us they were hearing most often in their state houses. And we see it in every state. They're also running candidates on an anti-vaccine agenda. They're coordinated, they're sophisticated, they know their stuff. I will say that I tend to differentiate the folks that are dispelling or that are selling disinformation from the folks that have misinformation. And so I think that a lot of the folks that show up to state houses to testify are often parents that are very passionate about child health and child safety that have misinformation. And I think there are lots of opportunities to try to educate those folks and counter that misinformation. But there's also a very malicious subset of folks that seek to profit from this and then gain advantage from this. And they're the ones really driving the movement. And, they're doing conferences, they're attending town halls, they're putting out voter guides and endorsements. And in many ways, we're very ahead of the pro-vaccine majority. I think many of us, including me, really took vaccines for granted. And the pandemic has really helped people to understand how vital they are to our health. When it comes to the national organizations, I've listed some of the bigger national organizations that are out there. The key takeaway from this is that they're running legislation in state houses across the country. And in the past year, Safe Communities Coalition tracked about 1,500 anti-vaccine bills across the nation. They are very, very sophisticated and not going to stop anytime soon. The buckets of bills that we see and track are bills focused on discrimination. We saw this in states like Louisiana. This would actually create a protected class and create a civil violation for anyone, including teachers in some cases, or employers who inquire about vaccine status. Like Maine, we've seen school vaccine policies, particularly under COVID, introduced, and that's everywhere down to from daycares up to college campuses that could be affected by those policies. We've seen employer vaccine policies go as far as Supreme Court cases, and then bills based in misinformation and fear tactics. One of the bills that I predict that we'll see quite a bit in states in the coming year is a bill based on what they're calling the abortion vaccine transparency connection, in which they want folks to understand that they believe that vaccines are derived from fetal stem cells. And so there would be a disclosure required with every immunization. And it's just a huge opportunity to spread fear and misinformation. And then health departments, we're seeing a lot of scope of practice bills and removing authority and removing the ability to add vaccines to the schedule. So, and these are bills that they have been testing in smaller states successfully and then rolling out in bigger states. So the infrastructure is there, the talking points are practiced, and they have their relationships to try to get these bills through. So one of the things that we did in Maine was start an organization called Maine Families for Vaccines. We kept the logo simple, cheerful. One of the things that I felt as a communications person is that the anti-vaccine movement can be so negative and frustrating. And I knew that if I was going to have to look at a logo all day long, especially while volunteering and working full time at that point, that I wanted it to be something that spread a little bit of joy and made people feel some of the hope that I feel in this movement, because it can be a real drag, but it can also be really hopeful. And we cast a very wide net. Maine Families for Vaccines in its campaign was able to onboard 64 different organizations to our pro-vaccine coalition. And we looked at the usual suspects: medical associations, the public health groups, providers, every hospital system in the state supported our campaign. But we also looked at faith-based organizations. We looked at where the misinformation was coming from, and we looked at some of the arguments that anti-vaxxers were using to try to spread misinformation and seed distrust in public health. And a lot of those arguments were faith-based. One thing we know is that every organized religion encourages immunization. For example, in Christianity, folks are encouraged to care for their God-given body and the bodies of others. So Safe Communities Coalition currently does a lot of outreach in churches and in ethnic community-based organizations with churches of color to talk about the ways that misinformation has been targeted at communities that may be particularly vulnerable to that kind of misinformation. We looked at schools, childcare providers, everyone from the AARP to the Maine Council of Churches, and we're able to cast that wide net to bring a lot of folks on. And I attribute our success in large part to that intentional focus on diversity from the outset. And it worked. Like I said, we won the campaign. And in the time since that bill has passed, we have seen a remarkable decrease in the number of opt-outs at the kindergarten level. We went from about 6.2% to 1.8% from about 2018 to 2022. And that's the Annie Casey Foundation Kids Count data. So we know that it's working. We also have recent data that shows that Maine's pertussis rate has gone down considerably as well. Are there any questions at this point? I see some questions in the chat.
I posted 2 notes to everyone, but I haven't seen any questions coming yet.
Great. So we founded Safe Communities Coalition and started to replicate the Maine Families model in other states. And in the past year, really focused on Louisiana, which at the time had 39 anti-vaccine bills introduced in their legislature. And it was trial by fire in a lot of ways, and an interesting proof of concept for us, because Louisiana is very different both politically and culturally from a state like Maine. But we worked the model, we put parents first, we did all of the work that we do to organize at that community level. We found advocates, we worked with the partners, and one of the things that Safe Communities Coalition prioritizes is local control when we come into a state. We want to recognize the work that's already been accomplished there. We want to respect the culture that is there, and we want local ownership of an organization that we come in. So we do a lot of capacity building and training and technical assistance with the organizations that we help to start, but ultimately the talking points that are developed and the battles that they fight are theirs and unique to the partners that they bring on. We did a whole brand, as you can see. Again, we strive for happy, family-friendly, fun, very accessible. And we hosted a day of action at their capital and brought in about 40 people, including their Power Coalition, which is a broad organization focused on social justice and diversity in social justice. And we're able to bring folks to the Capitol and to see the ways that immunization intersects with other issues that people are already advocating on, whether that's child health or child safety or family safety. We did a paid social media campaign down there that helped us to acquire volunteers and other folks that might be interested. Also got attention from legislators. And then we leaned on the experts that were already there in the state. So some photos from that day. This guy in the t-shirt out front is Dr. Briggs, who is a pediatrician in that state who's been outspoken. And then this is Jennifer Herricks, who's one of the directors of Louisiana Families for Vaccines. She is a microbiologist and parent. So we did local meetings with lawmakers. We distributed floor sheets and legislator guides and wanted to make sure that we were getting accurate information about immunization into the hands of legislators, especially those that might be new or might be feeling pressure from their party to vote against immunization, in spite of the fact that we know a majority of their constituents are pro-vaccine. Folks testified in their committee, and then we were able to get media attention. So Jennifer and Dr. Griggs were featured on Fox News the morning of our day of action. So of those 39 anti-vaccine bills that were introduced in Louisiana, only one bill made it through both chambers. It was COVID specific and it was vetoed by the governor. So we were able to fully stop all of the anti-vaccine legislation that was seen that year. And it took a lot of hustle. It took that in-person testimony, getting folks to the state house, training them up on how to testify, how to write letters to the editor, and how to be good pro-vaccine advocates. Let's see. One of the things that we really saw was great feedback from lawmakers and their allies. You know, there had traditionally not been a lot of citizen support for a pro-vaccine agenda, especially in a state like Louisiana. And a lot of legislators were hesitant to stick their necks out because they rightfully understand that vaccines are a very sticky wicket. But when you're able to get constituents calling and emailing their offices, showing up, handing out information and giving them that support, they have cover for the votes that they want to make anyway. Louisiana Families for Vaccines recently incorporated as a 501c3 and a 501c4 nonprofit, and they're off and running as their next session approaches. One of the things we've learned from this work is that we've got to reframe the debate. You know, the public health infrastructure is doing fabulous, fabulous work. And there are a number of really good education organizations out there. But for the advocacy side of this, putting families, schools, and communities first is absolutely essential. And it's essential to work in the community to educate people about their stake in this, especially people that might be most affected by social determinants of health or people that are most vulnerable, helping people understand not only that they have a voice, but that they have a responsibility to use that voice is a big part of that. And again, we keep things respectful, family-friendly, and fun. We really try to find ways to engage volunteers, give them titles, give them ownership, and help them develop personally and professionally, and make friends. So we try to keep the fun in the work because we know that it's a long haul and that people give up a lot of time and energy to do this. We learned to collaborate with those non-traditional organizations early, to think creatively about groups that might have a stake in immunization. Here in Maine, we found that organizations supporting folks with HIV and AIDS were interested in that, and that's something that we might not have thought about until we were actually approached by an organization that asked to join our coalition because they had a stake in that. And Equality Maine was also interested in joining our coalition. So the harder we looked, the broader that majority became for us. Be prepared for a circus at public hearings. I probably don't have to tell you that. We typically hire security in most of the states where we're working. So this, you know, it's serious work. And it's become really politicized and really heated. So we try to keep the conversation and our talking points on a very even keel. We try to be a very trusted and calm sense of support, especially for legislators and volunteers that are looking for those very clear answers. So these are the 7 states that Safe Communities Coalition is currently working in. As you'll see, kind of across the logos, there's a cuteness that I've mentioned. And one of the things that we are attempting to do is build a cohort of states that can work in collaboration and share takeaways from their wins and losses. Every state has its own unique cultural identity, and we're learning a lot as we see the types of bills introduced and the types of talking points that are most effective in those states. But we're also helping to convene those organizations with training and technical assistance and capacity building so that we can build the national pro-vaccine movement to counter the national anti-vaccine movement that we're seeing in other states. So when it comes to New Hampshire, New Hampshire is increasingly hostile. We see that in states across the nation. Last year, there were 44 bills introduced that were considered anti-vaccine, and 6 of those bills were enacted. And I've got the list here, prohibiting healthcare providers from refusing to provide care or services based on patient vaccination status, relative to state enforcement of federal vaccination mandates, prohibiting the state from requiring businesses to require vaccine or documentation related to vaccination or immunity status, including state medical facilities and the statute providing medical freedom in immunization, and relative to licensure of case management service providers, relative to administration of the state immunization registry. New Hampshire is one of the few states that has changed to an opt-in model, and establishing a committee to study the listing of immunizations for children. So as we prepare for the coming session, some of the things that we learned is that those midterm elections really mattered. We didn't see the red wave expected, but we have seen our legislators become more conservative in significant ways, especially as anti-vaccine advocates get really good at running candidates from levels down to school board all the way up. They're training these folks and they're arming them with talking points. One of the things that we're seeing nationally is that anti-vaccine activists are tired of COVID conversation, and they want to return to the traditional model of spreading misinformation about all vaccines and sowing doubt in all vaccines. COVID had been kind of siphoned off both on their side and I think on the pro-vaccine side. And I think they're rapidly becoming tired of that conversation. And then the National Vaccine Information Center is sharing model legislation and shopping it with lawmakers. And so we're seeing bills, as I said, run across multiple states to see what sticks. So we need folks, and that was one of the things that I really felt when I stepped into Maine's State House and saw how many anti-vaccine activists there were. Where are we, and how do we get more folks to show up? So, keeping the phones ringing, encouraging people to understand that they can be advocates, that their voices really matter, talking about the impact of that, encouraging lawmakers, especially lawmakers that are pro-vaccine or amenable to thinking about pro-vaccine legislation, to encourage their constituents to reach out as well. And, in a lot of cases in the nonprofit sector or in the public health sector, making sure that professionals working in those fields are aware that they are allowed to advocate personally and they're allowed to be involved in their community, even though they might be working for a 501c3 organization. So, we expect everyone to be a trusted source of information, to be aware of who your legislators are, and calling them, talking about why you support fact-based vaccine and public health policies, and thinking creatively about how to get that information out to folks that might be able to be advocates, especially for medical providers. Offering to be available for a meeting to answer questions with legislators can be very, very powerful. One of the things that surprised me is how willing legislators are to listen to physicians and how open they are with their questions about that. I think it's easy to expect our legislators to know everything and want to kind of talk about everything, but that's unrealistic. And a lot of them are genuinely very confused about the facts that they're given and need that education. building those relationships with staff, especially in states like New England that are very, very small, it's easier than you'd think to get that information in front of folks. So Safe Communities Coalition puts legislative packets together to distribute to legislators. We make introductions, and then we offer ourselves and our partners at the AAP as experts that can answer information either about vaccine law or about immunization in general. And folks really do avail themselves of those resources. We also put pressure on lawmakers to hold meetings in their districts with constituents, especially those that might be really entrenched. If there's a big vote coming, it can be very powerful to have them sit down and listen to pro-vaccine parents that might have a story to tell. One thing we see from anti-vaxxers is that they are very powerful storytellers. And as I mentioned earlier, there are a lot of parents on the anti-vaccine side that have fallen victim to misinformation and feel very, very passionately about their family's story. They're comfortable sharing that story. They've received media training. What we need to do is find empathetic ways to let the truth be known and to share stories from the pro-vaccine side of this about the kids that are affected, about the families that are affected, about how this affects our workforce and our economy and the broad impact of anti-vaccine legislation. So finally, for the pro-vaccine movement to be successful, we need to build a diverse, sustainable, nationally coordinated grassroots advocacy network in every state. And that's my vision for this. I'm happy to take questions. So thanks.
That's great, Caitlin. Thank you. So let's see here. We do have a few questions that have come in. The first question is, there's also been a lot of nice comments. So people love the stork. Your takeaways are spot on, and the logos are friendly, but immediately can recognize the message. And there's that nice continuity of branding across the different states. But how the question is, how did you pick those states to start with?
So SAFE partners with something called the Infectious Disease Prevention Network, which is the trade association for bio, and that's many of the pharmaceutical manufacturers' trade associations. So that decision to partner with Big Pharma was not one that we took lightly, certainly. And Becca remembers when we ran our pro-vaccine campaign in Maine, the anti-vax team chose "Reject Big Pharma" as the sign or the slogan that they put on all of their yard signs. So they raised that specter of Big Pharma early. And deciding to partner with the manufacturers made sense, partly because they had the expertise and the capacity and frankly, the funds to make that happen. And so a number of the states that we've chosen to work in have been determined by that partnership with the Infectious Disease Prevention Network. And then we've also looked at states where we think we can be the most effective. And unfortunately, we're really on defense right now. Massachusetts is one state where I have some hope that we may be able to remove non-medical exemptions. I think they've got a good shot at going on offense this year, and we're excited about that. But states like Montana have traditionally been states where anti-vaxxers find hospitable legislatures and folks that are willing to run anti-vaccine bills. And so we know when we go into those states that we can be effective. We also look at the existing infrastructure in a state. So Arizona, for example, has TAPI, which is their pro-vaccine coalition. And TAPI is just world-class when it comes to defeating misinformation, driving advocacy, organizing people, pulling that coalition together. So there were a lot of partners in place in Arizona, and they really just needed us to come in and start building that parent piece of that to do advocacy. Does that answer the question?
Yeah, I think so. Andrew, if not, feel free to put a follow-up in the chat. There is a question about whether we got a thumbs up. All right. Have the anti-vaxxers taken positions against animal vaccination laws? For example, rabies. It's an interesting question.
That's a really interesting question that I don't know the answer to. So if anybody else knows the answer to that, I would love to have that conversation. One of the things that we see is a lot of creep. I mean, what we know about the anti-vaccine movement is that it has a lot of really strange tentacles. And I always talk about how I'm an anti-vax anthropologist, that there are lots of different kind of flavors of anti-vaxxers. You know, there are the anti-vaxxers that are very focused on kind of health and cleanliness, and there's some kind of creepy connections to white supremacy and all of that. There are the ones that really believe in the idea of medical freedom and are anti-mandate. And so there's lots of ways that sort of the Venn diagrams intersect, but we tend not to get into anything except human vaccines. And then we also don't really get into scope of practice arguments either. Our channel is very narrow and very deep, but we're always conscious of the ways that immunization is focused on issues like aging, race, rurality, access to care, misinformation, that kind of thing.
I know because we participated in that campaign in Maine. It can be intimidating, especially on social media. I mean, you talked about needing security. Like there is an intensity to engaging in this work, and especially like you had talked in the beginning about training people about how to do this. And I'm wondering if you can just like give us some more information about that, because I can imagine there are people that are pro-vaccine that do care a lot about this issue, but that are really freaked out about the thought of getting into like a Facebook spat with somebody or getting trolled or, you know, all the things that come with this area. And so can you just talk a little bit more about that, about how do you train advocates and what does that look like?
Yeah, I mean, it's been an education for me. I thought I knew what I was getting into when I stuck my neck out with this and really had no idea. I mean, we, during the campaign, did get death threats. I got a lot of really creepy emails. You know, my husband and I got a Ring doorbell just to feel extra safe. And had to have a lot of conversations, especially when our son was very young, although he's only almost 5 now, about what this means for our family. And I tend not to think about it so much anymore, but have definitely had moments like when we were in Wisconsin, just touring the state house, there was a pro-choice rally. They have a big, beautiful rotunda with all of the different levels. And so there were people cheering. You know, I was like, wow, the power of advocacy. What a powerful moment when people show up and sort of feeling like wonderfully American. And my colleague, who's a little more tuned into reality than I am, said, you know, Wisconsin's a conceal and carry state. So did you notice we didn't go through a metal detector? And I thought, oh yeah, this is, you know, this is serious work and people feel very passionate about it. And I think it becomes very personal very quickly. And because we're talking about our kids, and for anti-vaccine advocates, they are genuinely convinced that some of the conditions that their kids might have or some of the things that their family has experienced are attributable to vaccines. So we really have to remember that many of these people are not bad people. They're doing what is in their hearts and what they think will save lives and protect children. And so keeping that frame of empathy on it is so important. We also don't get involved in personal attacks. You know, I had to, and I'm sassy. I'm online 24/7. I'm so sassy. I love a quick retort. I hate stupid people. I hate lies. And so I had all of these like little retorts in the comment sections. And it took me about a year and a half to realize that that's not how we're going to win people over. You know, the education efforts that are out there, organizations like Voices for Vaccines, Vaccinate Your Family, immunize.org, state departments of health, the public health associations, the AAP, everybody is doing a really good job getting into those communities and dispelling that misinformation and being trusted. And so why I ever thought that somebody was going to listen to like a middle-aged blonde chick from Maine just because I said something a little snarky So we work to educate our volunteers and say, this isn't it. This isn't how you win hearts and minds. What you need to be doing is going into your church, your daycare, your Thanksgiving dinner, wherever it feels safe and appropriate to do that, and coming out loud and proud as a pro-vaccine advocate. And that doesn't mean that you need to know everything about vaccines. That was the other sort of misconception that I had about this work. I thought I needed to really understand how an mRNA vaccine works and the science. And the fact is, my brain is probably not going to hold all of that information, and it's not my job. I want people talking to their doctors. I want people getting access to care so that they can have those conversations with the experts. My job is to make sure that the pro-vaccine majority knows where the state house is and that they have a right and a responsibility to be there and speak up. And I love that. It's not the truth of the message that matters, it's who delivers it. Yeah. So we empower people to tell their stories too, and to give them the courage to tell their stories. And I won't pretend that it's easy, but I will say it's been a real joy. And in Maine here, we had a group of mostly moms that really spans the 16 counties. I think we have parents in every county, and they have a WhatsApp chat going that if I check it at any given time, there's a couple thousand messages. I mean, they're just in constant conversation with each other. A number of them have immunocompromised kids or spouses. And this has become their passion for them. And they have found the kind of support and community that anti-vaxxers offer to parents, especially moms, that may not be finding that. And I find that incredibly hopeful.
You are very funny. I will say that because I've seen your threads and you are very quick-witted. So I'm a little envious because I'm thinking like, oh, 3 days later, I thought of a witty response to that thread I was following. So there's definitely, there's value in that. And so I think what I take away from what you're saying is that people who care about this issue, even if they don't want to get stuck in that thread that can go on forever, a rabbit hole on social media, have that stress. Maybe it feels like too much to show up to the state house, but there are other ways. Like you can reach out to your legislator, you can share information, you can talk with your family and your friends, in a way that you feel good. I mean, all of those things together is what helps advance campaigns. And so really it's about plugging in a way that feels right for you. Am I hearing that from you, right?
Absolutely. Absolutely.
Yeah.
And there are so many different ways to get involved. In fact, one of the things that we just developed for some events in Florida, my son and I put together a little coloring book called The Story of Vaccines. And it's just you can see he's colored all over it. But it tells the story of vaccines for younger kids. And we developed that as a handout for some church events that we did in Orlando and Tampa. So it could be as easy as bringing something like that into a setting where it feels appropriate, and assuming support as the pro-vaccine majority. Vaccines shouldn't be political. And I think a lot of people are very frightened to speak up about that. So it doesn't necessarily have to be putting your name in the newspaper or showing up to the state house. In Louisiana, we had postcards. It's actually a pelican in Louisiana, not a stork. We had postcards printed that kids could color on and then send to legislators just saying that my family cares about immunization. So there are lots and lots of creative ways to get that attention.
That's great. I love the idea of the postcards. It's a nice way too to get kids involved and for people to know that kids care about this issue too. Like they want to be able to go to school and not have to worry about getting sick.
Yeah. Yeah.
So you talked earlier about responding to misinformation and, a lot of, I appreciated the Venn diagram and the anthropological study of people who are not supportive of vaccines. And you talked about for some of those folks, they're reacting to misinformation, and that's combined with a personal experience that they've had. And at Maine Public Health Association, we've co-hosted with several other organizations, town halls and Q&As with providers, with nurses, and just with other health professionals And I'm wondering, so I've seen that model, but what are some other models that you've seen that have been effective for helping to correct some misinformation, like in the moment?
It's a great question. I mean, we don't do vaccine education so much, but um, I think, especially when we work with volunteers, and one thing that I've had to learn myself is saying, I don't know, and can I get back to you is so important. I mean, I can't reiterate that enough, but being able to listen to folks as well and bringing that empathy lens, it's very easy to demonize anti-vaxxers and to sort of turn them into this like diluted, politicized movement. And I certainly think there's a fringe there of folks that are diluted and highly politicized, but the majority of people that have bad information out there are not bad actors, and they want to be listened to. And one of the things that we're trying to look at is, and to remember, is the reasons that people turn to anti-vaccine ideology. In many cases, it's because they haven't had adequate access to healthcare, or they haven't had adequate access to healthcare education. They may not have the tools to understand that. When you look at BIPOC communities, there are a lot of reasons to distrust the established medical systems that are in place. When you look at women's health, for example, there are lots of reasons that women have taken things into their own hands, and that there are these very powerful networks of parents sharing information that may go against established medical guidelines. I mean, I have a great friend who's a Harvard trained attorney. I mean, she's one of the smartest people that I knew. And when I had a baby, she gave me a huge book of like parenting information that she found incredibly valuable. And it was written by a notorious anti-vaxxer. I was absolutely shocked by that. But, as a new mom, and, I think we've talked about this together, as a lesbian mom, she felt very seen by the information that was provided. It felt very comforting. It feels intuitive. It feels less sterile. And so I think people are very welcomed into that. And so we try to think of ways to welcome people into the conversation about immunization in ways that resonate similarly. This is about protecting your community. This is about protecting your grandparents. This is the thing that you can do that protects you personally. And we look at motivation.
Yeah, there's a comment in the chat about, there are a lot of people, unfortunately, in the US that don't have strong scientific education backgrounds. I mean, starting even from, primary and secondary school. And so that can make it a little bit easier to not necessarily think very, very critically about that misinformation, because having that background understanding isn't always there. Like, I don't even think everybody understands the difference between a virus and a bacteria. So then, that makes it, you don't necessarily think of the right questions to ask when you see information. There was a nurse on one of our calls from Millinocket Hospital, and he was, I think they were the first state in Maine to achieve 100% or close to vaccination. And one of the things that he committed to in his role was responding to people who asked him questions. And so people who were kind of on the fence about COVID came to him to get their questions answered. And a lot of what he was doing was asking them about the sources. Like, where did you see this information? What do you know about this source of information? How are you interpreting this? And then he would take the time to go back, and I mean, it's an incredible amount of work, and he was really focused on that hospital. So he had like a sort of concentrated population, but it really just stuck with me how much work it was for him to address the misinformation. But then the consequence was, I think it was 100% vaccination for people who, didn't have another medical concern for not getting vaccinated otherwise. So I think that the point about, asking questions and certainly using, plain language and all that, but I think that's important. It also can just be helpful for people to talk through what they're thinking with somebody who may not agree with them or may have a different lens, because we easily can get caught up in our echo chambers on both ends of this issue. So I think that can be be very helpful. So I think that, and you spoke a little bit about this too, but when people don't necessarily know the answers to some questions like an mRNA vaccine or whatever it is, where can there were a couple of different resources in the chat about where places where people can go to get helpful information. Stronger.org, the panic virus, which was written by a journalist and not a scientist, which is actually very helpful, I think, in terms of the digestibility of the information. But are there other resources? I mean, certainly, okay, so Voices for Vaccines, I mean, certainly Public Health Association websites, AAP, all those places, but are there other, that's what I was just getting, everything you're putting in the chat, are there other places you recommend people go to kind of get good talking points to respond to some of the common counterpoints to this?
Yeah, I think, Voices for Vaccines, Vaccinate Your Family are really good at that conversation. And if you're somebody who is working in the community and finding yourself against this, Voices for Vaccines in particular has a really good podcast series, and they've had a couple of roundtable conversations, including one with a mother who was anti-vaccine and then switched. And then there's also a teenager who's, when I'm forgetting their names, but their parents wouldn't allow them to be immunized. And then when they turned 18, they were able to be immunized. And I've learned a lot from listening to those folks talk about the switch. And I will say, I think the facts matter so much, especially if you're somebody who finds themselves in a position of authority or with the ability to sort of answer questions and dispel misinformation. But keeping in mind that this is not necessarily a logical decision for a lot of people. And what we know about confirmation bias is the more you present somebody who's really locked in with logic, the more their brain is going to work to protect them from the fear that they feel. So it has to be about addressing that fear in the first place and finding those places of common ground. You want to keep your family safe. You want to do the right thing for your kids. We all care about our community. We all want to do the right thing. So I understand that you have some concerns about what's in this vaccine. And a lot of times you'll find that somebody isn't necessarily against all vaccines. They may just have, one or two that they've sort of differentiated. One of the things that I've seen traveling in Louisiana and Florida is that people will say, even at our pro-vaccine events, oh, I love vaccines. I showed up because I know this is a pro-vaccine event, but I don't mess with the flu shot. That's the one. Every time I get the flu shot, I get sick from the flu shot. And so you've kind of got to find those ways that people want to be rational about this, but maybe have that fear-based response. I talked to somebody in Florida who said, I got the flu shot 3 years in a row and I got sick every single time. And I can't afford to take off work because I keep getting flu from the shot. And so you have to talk about the consequences of missing work for this guy and say, I completely understand that. That's so frustrating. It must feel really unfair that you have to do that. One thing that I learned is that when you feel ill after a flu shot, that's your body fighting. And it's better than getting the flu. Can you imagine how much time you would have to take off if you didn't get the flu shot this year? So yes, you're not feeling great, but you're not feeling great for a day or two. What if you got the flu and had to be out for a week? What would that look like for you to have to take that kind of time off? And you're training your body to be stronger. And then returning to that conversation as much as you can again and again and again too. One of the things that I really want to see is norming this too. More and more parents just being very vocal about that in their parenting groups with their families and saying, yes, of course I got my children immunized. It's important to me, so that it becomes normal, so that opting out doesn't feel like an option. I think so many parents are presented, and I even felt that way as a pro-vaccine parent. People sort of said, well, are you going to do the graduated schedule? Or have you thought about which vaccines you're going to get your kid? Or, what decision are you going to make about this? And for me, it wasn't a decision. It was the right thing to do. And I knew that I was going to trust our pediatrician and work with her on that.
When you brought up the flu example, it made me think about, and you had talked earlier about non-traditional partners. And I know that Maine Families for Vaccines and Safe Communities Coalition, when I look at the logos and everything, like there is a focus on kids and on communities and on families. But in thinking about non-traditional partners, I'm wondering if you have partnered with the business community, and have you seen, have there been businesses that have been outspoken about this and talked about the consequences of not having higher vaccination rates on their workforce, whether because parents have to can't work because they're caring for their kids, or because their workforce is out with a shared illness? I'm just curious if that's been one of the non-traditional partners that you've seen work on this issue.
We haven't so much. I will say there have been a number of businesses out there that have been willing to, require immunization of their workforces. And we're really positive about that. Because we work specifically on legislation, the business community is generally pretty shy about getting involved and supporting that, though we have had employers testify on bills before. And I think they need to hear from their employees. I mean, if you have an employer, if you know of an employer who is doing good work to protect employees by requiring a COVID immunization, for example, it's important to be outspoken about that and to say, this is something that's helping to keep my family safe, and this is something that makes sense. Or if you know of employers that are not making those safe decisions, to say, have you thought about the impact that this might have on our workforce? That feels like a very short-sighted decision. And that's where keeping that public pressure up really matters. That's where the op-eds matter. And that's where the policy decisions can make such a big difference, because it shouldn't come down to individual employers having to make that decision based on the politics within their organization. We know that this is the right thing to do. We know that this is the safe and effective thing to do. And so policy is the way that we provide cover to everybody to get this done at a population level.
Yeah, we ran a campaign, I forget what year it was. I think it was 2021, called Keep Maine Open. And it was a business campaign. And we had business owners talking about the impact of COVID on their staff. And if there's an outbreak and they have to close, then that's lost wages. They want to keep their community safe. And they didn't testify in any bills, so it wasn't advocacy related, but it was promotion related. Like we had YouTube ads and all sorts of other media related to it, because there was like a business lens. But again, it wasn't, as far as I know, they were not showing up for any of the vaccine bills, but there certainly was a connection there. So I could see how, in spreading this broader message and in thinking about some non-traditional stakeholders, that could be a helpful voice and an unexpected one, I think, in some ways.
Yeah, and I think it's help support employers in doing that. Thinking about, would it be possible to bring an on-site clinic? How do we reduce barriers to immunization? How do we give employers the information that they're so hungry for? We did a whole series here in Maine, Becca, you remember, with churches, because they were seeing reduced membership due to COVID. They were seeing a lot of division and kind of dropout because people were really frustrated by the decisions that they were making to gather in person or on Zoom. And so we were able to educate a lot of the pastors of those churches about immunization so that they could be leaders and talk to people about that and keep their organizations operational.
Yeah, I mean, certainly, I can see how for a business and for a church, for any organization like that would have to be a little bit of a political decision for them, because they may see the health benefit, but then also, they don't want to lose revenue or attendance. So I can see that. So I agree with you, though, about providing support and really uplifting and expressing public support if a business or any other organization comes out and in supporting, pro-vaccine efforts. Well, that's exhausted all my questions for you, Caitlin. Thank you for this back and forth. I feel like we've been having a conversation over coffee or something.